Welcome back to Made to Be Whole. Stay tuned for our conference recap as I go over what I learned at this year's annual conference of the Alzheimer's Pathobiome Initiative. Made to be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing. This is Krista. Welcome back to the podcast. So I recently had the opportunity to go to the second annual conference of the Alzheimer's Pathobiome Initiative. It's a really, really cool organization that's a little newer. It's grassroots. It's a global interdisciplinary collaboration to clarify the role of microbes. So we're talking about infection-causing organisms in Alzheimer's disease, other dementias, and beyond. So one of the things I like about this organization is it's very grounded in science, but it also is interdisciplinary. And so you have a group of people from diverse backgrounds, which I think make the conversations much more interesting. The executive director is a woman named Nikki Schultek, who was actually a patient, not an Alzheimer's patient, but she became very critically ill, was later discovered that she had Lyme disease as well as several other infections. Was pretty disabled at one point by all of that, and as she's recovered, she wanted to step in and make a difference. And so if you go to their website, which is alzpi.org, you can look at their team members and you'll see PhDs, MDs, you've got veterinarians, you've got people with a wide range of backgrounds, which I think facilitates more honest conversations. And one of the things I liked about this conference that I feel like is missing in some spaces is this idea that very, very rarely are the contributing factors simple, that it's not monocausal. It's not as if, oh, I have dementia or my mom has dementia and they have Lyme disease, and that's what caused it. We treat the line, everything goes away, the end. As we've talked about extensively in the context of infection, it's complex because you have the intersection of the actual infection, which lots of people get, by the way. There is no infection out there that's really, really rare. I think that some things are more rarely diagnosed, but we're all exposed to things all the time. Why do some people become sick and some people not? It's the intersection of the infection, the environment, and your genes, your genome. That's one of the reasons why I'm pretty passionate about using the genomic testing that we've addressed, because it exposes vulnerabilities and helps us figure out why did this person get this infection and have this particular presentation. So if you are looking for a review that says, aha, they have proven once and for all that Lyme disease or chlamydia or Epstein-Barr causes Alzheimer's, you're going to be disappointed. There are a lot of different infections that are associated with it that seem to make people more vulnerable, and it seems to be that constellation of bad fortune, I guess, that drives it. One of the things I thought was interesting, Garth Ehrlich was there. He's on their board, and I've heard Dr. Ehrlich speak multiple times at ILADS. He's a researcher in Philadelphia, but he just got back literally the day before the conference from a dementia conference in Germany. And he said, over there, all of this is just accepted. I mean, it's very, very well known and established in the literature that dementias have infection as a contributing factor, and that's not up for debate. Here in the States, we get so much pushback and so much argument from people. I actually had a semi-hostile pharmacist call me a few weeks ago and chew me out for my use of antibiotics, and was not interested at all in looking at research or tests or anything, just said it was inappropriate and that I'm out to hurt people. I think that most people who practice in this space would tell you honestly that we would love to not use antibiotics as much as we sometimes do. But that's why early intervention and treatment is so important, because if we appropriately recognized and diagnosed infections in the early stage, we could use a course of antibiotics that could effectively stop anything from progressing to chronic illness or chronic form, and we would in reality use them for much shorter periods of time. One example is the really piss poor way that we have, oh, no pun intended, but it's a good one, approached bladder infections. So, with bladder infections, it used to be people would get treated for 10 to 14 days, and then the standard of care became, oh, you give 3 to 5 days of an antibiotic, and you only treat if they have severe symptoms. And a lot of providers define symptoms as pain, bladder pain, or pain with urination or burning, and it has to be pretty significant. But we know that bladder infections can cause other symptoms, including incontinence, urgency, sometimes pelvic pain, sometimes the symptoms cycle. Sometimes it's just that they're getting up a few times a night to pee that they didn't used to. And then we say, well, that's not that inconvenient of a system, and we don't want to be poor stewards of antibiotics. But none of our systems operate in isolation. They all talk to each other. And so any infection that's not properly addressed in the early stages has the potential to cause chronic things down the road. And I think it's really, really imperative that we we act early and appropriately, and that we utilize good testing. That's why I love, love, love my good labs. I love Microgen that I've talked about extensively. I love our good labs for these vector-borne infections because guessing's expensive too, and it's very imprecise. And all infections aren't created equal. They respond to different things. We know, for example, when somebody has Enterococcus faecalis in their urinary tract, their genital urinary tract, that we have to not just give a medication that kills Enterococcus faecalis, but something that has effects against the specific types of biofilms that that produces. We know that other infections are more prone to produce fibrin or other things that perpetuate chronic infection. So good diagnostics are a really, really, really big deal. So I'm going to hop back to the conference, a bit of a tangent there, but one of the things that Nikki Schultek said, the executive director, she's doing a great job, I think, trying to get information out there in non-academic journals as well, like writing things that are scientifically accurate, finding good publications so that this information can get into the hands of the public so that they can look for better care, so they're alerted. So it's not just waiting, not just dispensing information and knowledge to healthcare professionals and then hoping you get an audience with the right healthcare professional, but instead getting information to the public so that they can then find people who are qualified to help them. So Brian Balin spoke, he was one of the speakers. He said the link between infection and chronic disease is already well established. And that's actually true. If you step back for a minute and think, why is HPV such a big deal? HPV is a viral infection. Well, it's because we know HPV infection puts people at much higher risk for cervical cancer and for oral cancers. H. pylori is an infection that puts people at risk for gastric ulcers. And it was in my life that this was discovered. And the people who brought this forward were actually openly mocked and derided by other professionals at conferences when they brought forth their findings that it was this bacteria that caused gastric ulcers. That was not the standard. Ulcers were, well, the patient's fault. They had to do with stress or other factors, but certainly not an infection. Some of the other things that, if you delve into the literature, we know that toxoplasmosis puts someone at higher risk for schizophrenia, that enteroviruses actually are associated with higher risk of ALS. The chlamydia pneumoniae can contribute to MS risk. So there is a lot in the literature that already establishes the fact that infection predisposes people to chronic illness. So we have to do our due diligence in figuring out what infections are present and what can we do ideally in the early stages to prevent these chronic presentations from developing. So one of the things that he mentioned that I thought was fascinating, he talks about how infections can be transferred from the cranial nerves, including the olfactory nerve, to the central nervous system. And that when that happens, your blood brain barrier does not work as effectively. And then neurons get damaged by oxidative stress. And then there's decreased efficiency of all the protective functions that all of these things that are working in concert in our brains can do. That is one of the reasons that I have tried to be pretty I don't know if aggressive, but alert if somebody has sniffling that's chronic of any kind, or sinus pressure, or they have chronic respiratory issues or head issues. Swabbing the nasal cavity is a really great intervention because anything here in the nose can very easily travel to the brain. If you think about what its neighbors are, it can affect the gut because you have those secretions that get swallowed. Obviously, it can affect the lungs. So, swabbing the nose is fantastic. My two favorite tests for that would be Microgen, which I've mentioned. Microgen has the benefit of sometimes being covered by insurance. That's always what I do if somebody has Medicare because it's almost always covered by Medicare. Other insurances are hit and miss, but one of the nice things they do is because it's, sorry, DNA PCR testing, that we can get a list of pathogens, and that includes not just bacteria, but fungi, and you can add on a viral panel too. So you can have compounded nasal sprays made that target exactly what's there, and healing your nose can help to heal your brain and your gut and your lungs. It's all goes together. So that was from, like I said, Brian Balin. Then one of the other speakers, and I just am so impressed by how many smart people there were in the world. But McCall Capsey Tall, I think is how you pronounce her name, but she's from MIT. And she talked about how infection with Borrelia burgdorferi, which is the infection that causes Lyme disease, actually has a survival benefit for the tick itself. That's so fascinating. People keep asking why is Lyme so much more prevalent? Well, one of the contributing factors could be that infection actually is protective for the tick. Did not know that. And she also pointed out statistically 90% of people who get infected with Borrelia burgdorferi or Lyme disease actually recover. But why can these other 10% not fully recover? And then another question she asks is why do infections associated with chronic illnesses skew female? So the name of her talk was Unraveling the Immunopathology of Infection Associated Chronic Illnesses, Sex Differences and Predictive Diagnostics. So she brought up the point that it is really critical for us to distinguish between host and pathogen mediated pathology. So, host pathology, that means the person who hosts the organism, you, me, whoever's sick. What about pathology or illness is driven by us and what's inside us versus the characteristic of the actual infection itself? She also talked about strep infection. So, strep is the causative organism for PANDAS, which we've talked about. So, when it comes to the strep bacteria, 20% of people who have it are actually asymptomatic carriers. 20% walk around, they don't have anything wrong with them, they don't know that they have strep. 70% get mild illness. So that might be your people who have strep throat and they've got a little bit of sore throat, a little bit of a fever. They might get the swollen glands, have a couple of rough days, but they recover. But then 10% go on to develop either PANDAS or rheumatic fever. Again, we have to identify the 20% that are asymptomatic carriers, figure out what's protecting them, but then also treat them so they're not making other people sick. But having that early threshold for treatment, knowing, yes, anyone with strep throat actually really should be treated with antibiotics for their protection and for the protection of others around him, especially those who have this increased vulnerability to complex chronic problems. She had a lot to say. I thought it was really fascinating. She is involved with MIT's Maestro study, which you can read about online. Maestro as in Maestro, but that's an acronym. You can dig into that a little more, but a lot of smart people doing good things. Yves Monet talked about the brain pathobiome and Alzheimer's and other neurodegenerative diseases. And then we had the privilege of hearing from Madeline Cunningham. So I was excited about her inclusion in this conference. Some of you may have heard of the Cunningham panel, which is now called the Autoimmune Brain Panel by Molecular Sciences. Madeline Cunningham is the person that was named after. She helped to develop it. She talked about how she feels like we would be better served if things were renamed. This isn't a very scientific summary of that, but basically PANS and PANDAS, for whatever reason, even though these are well documented life-threatening phenomenon, there is a lot of pushback and a lot of politics about that. If we treated it all as a form of rheumatic fever, there would be better attention to it. Maybe we could take some of the emotion out of it, and get people help earlier. So the American Heart Association for the diagnosis of an initial attack of rheumatoid fever includes subcutaneous nodules. So that is interesting. There are other infections that can cause these nodules. Subcutaneous means just right under the skin. So Bartonella definitely can cause nodules. Babesia can, but strep nodules also exist. And if you go online and Google, you can see some pictures. Carditis, which is inflammation around the heart. Polyarthritis, which is inflammation and pain in multiple joints. And then chorea, neuropsychiatric symptoms, and PANDAS. Then by the time you progress a little farther, you can have abnormal EKGs, a prolonged PR interval on your EKG. The antibodies take time to develop, and the actual presentation of rheumatic fever or PANDAS takes time to develop. So that's why it's really important to treat early and not wait to see if something severe happens. I have some patients who are very sensitive about antibiotic use and they really don't like it and they don't want to use it at all. In reality, antibiotics are very, very life-saving. What's become a problem is the fact that they've been used even when it's not appropriate. But something like strep throat, it is really, really important. And I will bring up, we've talked about this in previous episodes, strep can be in other places in the body too. I've mentioned finding strep in the urine. You can find strep sometimes in the stool. You can swab the nasal cavity. We've talked about that. I found strep in the vaginal tract. Strep can hide different places. The sore throat is that classic presentation. But whenever there's sudden onset anxiety, especially sudden onset OCD, you've got to think strep and look for it different places. Oh, there was a lot more, but that's a little overview, and it was a real privilege to meet someone who's really changed things for people. One of the keynote speakers was Susan Manful, who's the director of the Alex Manful Fund, and that was interesting. Alex Manful was her daughter. She's an only child. She developed PANS PANDAS in adolescence, in late adolescence, and in her 20s, and then ended up committing suicide. She had an incidence of strep throat. I think it was around age 19. Then she had strep and mono, developed anxiety that she'd never ever had before, started losing weight, eating restrictions. There was some binge drinking that was uncharacteristic. Alex is actually the one who figured out what was going on and diagnosed herself. It was in her mid 20s that she found someone to treat it, but not very long after that, she was on vacation. She had a flare in her symptoms. Her mom said that she was on the phone with her and Alex hung up with her, which was really uncharacteristic. They had a really close relationship and then got off the phone and hung herself and passed away. And what both of the Manfuls have done, so both of Alex's parents, they founded the Alex Manful Fund, and it's thealexmanfulfund.org. But what they're trying to do is prevent others from going through what they've done. So it says on their website, our goal is that no other person will lose his or her life to pandas or pans, or lose the years it can take to successfully treat these post-infectious neuroimmune disorders. And so they have done quite a bit as far as education, funding research, and their emphasis is on adolescents and young adults. I thought it was interesting. There were a couple of speakers there who are doing really kind of remarkable work because of tragedies that they've been through. And it reminded me a little bit of the micro and macro approaches that we have to take to the difficult things in our lives. So, my husband and I actually were talking about it this weekend. We were going through a bit of a crisis with one of the kids, and we were just completely overwhelmed. And I told him, I said, Eric, we've got to do the micro and the macro approach. So the macro thing is the big picture. That's what's wrong with the system. That's all these big problems that need taking care of that absolutely are huge problems. But we don't have control over the system right now. Right now, we have to go micro and we say, how do we help the kid in front of us? How do we get through what's going on right now? After we get through that, then maybe we can address some of these bigger problems. I've had patients who have told me they just want to make a difference, they just want to be an advocate, all these really great motivations, but you have to go micro first. Before you change the world, you really do have to change yourself. You have to focus on getting yourself well, taking care of your family, and then when you're on the other side, you're going to be in a much bigger position to make a difference for others. Sometimes we can get so caught up in the big picture that we ignore or neglect the people in our immediate circle, and those are the ones that are honestly the most important. But I would recommend looking at the website for the Alex Manful Fund. The other thing that I like about their website is, as I was reviewing it, is they give a really nice, well worded definition of pans and pandas. They have pans and pandas fact sheets, they have newsletters, they have education and advocacy things, but it's scientifically grounded, it's well written. They're really pushing things from a science perspective. They donated Alex's brain to science and found a researcher to basically take stewardship of that because they wanted to make sure that what was learned from that would be of use to others. It's called the Pond Brain Bank at Georgetown University. And so the one of the other speakers was the person who's the director of the Pond Brain Bank, and he went through and and POND stands for, by the way, PANDAS, PANS, and other neuroimmune disorders. It's interesting. One of the things I will throw out there, hopefully none of you are in this position right now, but there are organizations out there that do accept donations of organs. And if you have been affected by tragedy or infection and there's someone in your life who has, there are some really reputable scientists out there that will accept tissue and organ donations. You just want to be really careful that it's someone who's going to be a good steward of that. But I think it's ultimately one of the things that's really going to help us change the world, because we cannot look closely at the brain while someone's living. We just can't. We can do imaging. There are other things we can do, that we can use markers, but we really, really can't see with current technology everything that's going to help us really move the needle on this. And so one statement they make on the website is how a single brain donation offers valuable information to hundreds of research studies because the brain is dissected and then preserved, and those donations obviously give a lot of hope. So keep that in mind. I've thought a lot about I guess I won't say a lot, but I have thought about science and an organ donation, and I've been listed as an organ donor, but then started to wonder recently if that's wise because some of my organs would probably be of use to someone, but I certainly don't want to give the gift of life and then the gift of babesia or other like sequestered infections to someone to make things work. So we could definitely do a lot more research with figuring out what's appropriate, what's ethical, how can we help make people make good decisions. Sean Miller from Yale, moving on, talked about SARS-CoV-2 induced Alzheimer's disease associated with pathophysiology in human retinal explants and organoid models. It makes me sound really smart to say that. Whenever I go to these conferences, I think I'm not smart enough to be in this room. However, I have had to do the micro macro view of that too. You can get overwhelmed going into these spaces thinking, I I can't match heads with some of these PhD researchers, and that's true. But if I can go to every conference and come away with at least two things I can do that can help one of my patients, then it's a win. So I go, I know some things I will soak up, I know some things I'm not really going to understand, but if I can come away with something actionable, it was worth it. Another thing that I thought was interesting about Sean's presentation, so they're talking about retinal explants. So the retina is part of the eye. There are so many people with chronic infection, vector-borne infections particularly, who have a lot of visual disturbances. And it's interesting because the vast majority of them go to eye specialists and go to multiple eye specialists and get told that their eyes are perfectly fine. There's nothing that can be discerned is wrong. And so a lot of them do have improvement in visual symptoms just with treatment from infection, but not everybody. So definitely having people who are looking closely at specific organs and tissues that are associated with kind of longer term sequelae of infections is a great thing. We had Janice Bush. She is a veterinarian but is also a PhD candidate who talked about differential gene expression of human microglia following infection with Bartonella henselae reveals dysregulation of genes impacting microglial function and neurodegenerative processes. So that is quite a mouthful, but I really appreciated her talk because the microglia is basically your brain's innate immune phagocyte. It's an important part of the immune function of your brain. We know that when there's microglial inflammation, that there's cognitive decline. And she talked about how microglial dysfunction extends beyond this chronic inflammatory state, but can express itself in a wide range of genes. So we've got all of these different genes that are affected by the chronic inflammation related to the microglial dysfunction. But what she said was interesting. She said these are long-lived cells, so early microglial changes can yield to neuronal pathology down the line. So that's something that's really important. We can have someone who has an infection and they don't necessarily seem super symptomatic at the beginning, but it can set the stage for other problems. And she brought up that Bartonella henselae, and Bartonella henselae is the strain of Bartonella that is associated with cat scratch disease. It's the one that's the most widely known. It's fairly common, but there are a lot of other Bartonella strains. That's why your standard Bartonella testing falls short, because if you send your sample to your regular lab, first of all, they only check for two strains of Bartonella. Second of all, their testing's really insensitive. But she talked about how with Bartonella, and specifically Bartonella henselae, because that's what they were studying, that it causes these cellular shifts over time. So you've kind of got this really slow, subtle cellular damage that is what creates the perfect storm for bigger problems down the road. Juan Fernandez from the University of Pittsburgh talked about antiherpetic tau preserves neurons through a specific pathway in Alzheimer's disease. But HSV or herpes has been also implicated in cognitive issues. And there are some people who just by going on Valtrex, which is an old medication that's approved for herpes, shingles, other things like that, have significant improvements. It's always worth testing and trying. It's because it's an inexpensive, safe medication. The afternoon keynote was by Nicole Bell. She's the CEO of Galaxy Diagnostics, which is a really, really great lab who its origins were at NC State, I believe with Dr. Mosiani and Dr. Breitschwart, but it's in North Carolina, and she had lost a husband to dementia associated with Lyme and Bartonella. He got late stage Alzheimer's at a not very late stage in his life, was diagnosed in his early 60s. He was older than her and had a lot of personality changes. Things were going really, really askew. They got eventually, I think after she said 12 specialists diagnosed with Alzheimer's, she went to see a famous neurologist and was digging for questions and said, why did this happen? Why is this going on? He's not that old. He was healthy. He was active. What happened? And she was told basically that, and I'm quoting here, but shit happens. Sometimes stuff happens. And that was not satisfying to her. So, of course, her first obligation was to care for her children, care for her husband. Sadly, he eventually had to move to a nursing home because he was very agitated. His dementia progressed rapidly and it was an agitated dementia. And it's just different when there are safety issues involved. He did pass away, but she's now the CEO of Galaxy Diagnostics. So she's another example of my micro macro dichotomy there, that while her husband was sick, she had to do the micro work, but she's been able to take her tragedy and apply it on a macro scale to help there be better diagnostics, because the sooner people get tested, the better, the more we can do to prevent. We want to be able to intervene when bad things happen, but we want even more is to prevent. So there was a lot more. I'm not going to throw in everything that I learned. I will give you a few other little pearls. One about Candida albicans. One of the things that was said that was really interesting with that. So that's a yeast, and that Candida albicans in the gut derived chronic microbial cerebritis causes neurodegenerative disease in mice. So this is a mouse model, but one of the things that she said was that when they dissected biofilms that were found, in addition to the yeast, they found the biofilms that were polymicrobial. This is really, really important. Polymicrobial means lots of bugs, okay? So I will have patients ask me, well, when you look at my biofilms, because we do that cool imaging through T-Lab that can show us the biofilms, they say, can you tell what kind of biofilm that is? Is that a Lyme biofilm? Is that a Bartonella biofilm? And no, I cannot tell looking at that, but what she said really, I don't know, helped to reaffirm what I have believed all along, is that biofilms, they just are kind of trapping what's in the neighborhood. So even though you may have some bacteria that are really particularly good at making biofilms, there's usually a bunch of neighbors in there. So if we're breaking open biofilms, we're releasing whatever's there. And in Dr. Bimler's experience, these were largely polymicrobial biofilms. Dana Carnes at Tufts talked about how herpes virus has a role in Alzheimer's. And so she also spoke, which I thought was interesting, about shingles, because that's a related organism, but how immunization against shingles has been shown to reduce Alzheimer's risk. So I love it when we can have challenging conversations because, as I've mentioned before, I think that we don't have a lot of great data and information on all vaccines and vaccine risk. And I absolutely believe that vaccines have become a big profitable industry because vaccine makers have zero risk. They have total immunity for what they do. But that doesn't mean we throw the baby out with the bathwater and that all vaccines are unnecessary and should be avoided. I think that's totally worth exploring because shingles can, first of all, be painful and there can be a lot of long term neurological things. You don't have to live very long to have met someone who has chronic pain related to shingles or chronic neurological issues. But then if we also have data showing that it can help prevent Alzheimer's. I think that's one we need to learn more about, do informed consent, and that might be one of the vaccines that's worth exploring later in life. I don't personally think that most people should be out there getting an RSV vaccine. I think that we over vaccinate and we over manipulate the immune system. We're putting a lot of people at risk for a lot of things unintentionally. But certainly anything that can help us with preventing something like Alzheimer's, we need to look more closely at. So those are my ramblings. The next time we speak, I'm going to be able to give you an overview from the upcoming ILADS conference in San Francisco, not San Francisco, San Antonio, one of the other Sans that I'm headed to. There's a lot of really great people on the program, and I'm excited to check back and let you know what I learned. So thank you for listening, and remember to have hope because you were made to be whole. Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.